Welcome back, everyone. Tonight, the eruption of that explosive parasite outbreak that has sicked upwards of 12,000 people across the country continues to surge, even as concerns are raised over the handling of the federal investigation into what may be causing it. And now, along with lettuce, you can add parsley and cilantro to the list of produce that public health officials believe may be linked to the outbreak. This is now the largest Cyclospora outbreak in U.S. history. One cluster, of course, is now somewhat infamously linked to lettuce in what is now a total of 9 states, with Illinois, Kansas, Oklahoma, Pennsylvania now added to that cluster, including Indiana, Kentucky, Ohio, West Virginia, and of course hard-hit Michigan that were already on that list. Now that's where the number of cases now tops 9,000 with 160 hospitalizations, surging by about, get this, 1,000 cases since Michigan's last update. That was just on Friday. The CDC says it continues to link that outbreak with iceberg lettuce sourced from Taylor Farms. The company has issued a voluntary recall of products sourced in central Mexico and says it's conducting a top-down food safety review. But now there is a second, separate Cyclospora outbreak that, as of last week, has sickened 72 people. And to date, we don't have a known origin. Meanwhile, the former head of the FDA, Scott Gottlieb, is praising that agency's efforts to track the parasite, but he's also warning this outbreak is far from over.
A lot of restaurants, a lot of wholesalers, retailers have been able to cut off supplies from central Mexico, and I think that mitigates the risk. I don't think this is fully under control yet because we don't know for sure that that's the only growing region where this is coming from.
Well, there is a new poll. It's there on your screen. It shows 40% of Americans are buying and eating less produce amid the outbreak. I know I am. Joining us now, the former head of the CDC, Dr. Robert Redfield. Now, during his tenure as CDC director, Dr. Redfield oversaw the agency's response to the COVID-19 pandemic, as well as multiple Ebola outbreaks. Welcome back to the show, Doc. I want to start with your take on how the FDA has handled communications with the public on this outbreak. We heard from Gottlieb, who, of course, was the former agency acting director, but he adds there hasn't been as much communication from the agency as you might expect. What's your take on that? Has the FDA communicated well enough with the American public?
You know, Hannah, I think that's, I think it's a judgment call. I think, you know, it was slow to really get the message out. I really think in the last week or so, most of the American public are aware now of this outbreak. As you commented, it's now the largest in the history. You know, even just the state of Michigan's reporting over 8,000 cases, you know, which is huge considering 2 weeks ago they had much fewer, you know, cases. So it's a very significant outbreak. Obviously, the iceberg lettuce from central Mexico is one of the sources, but as you commented in your read-in, there's now pretty good evidence that there's an outbreak related to cilantro and parsley also that may be from a different area. So it's not clear. I agree with Gottlieb that I think there's other sources that we haven't identified yet. And it gets back to your big question, what do we do about it? I think you have to be more circumspect about fresh produce. You know, where you can buy your produce locally, I think that makes a lot more sense because really the risk of to the public right now seems to be produce that was sourced internationally, particularly central Mexico, but other places. And if you look historically at the outbreaks we've had in the United States, they've really come from produce that was sourced outside of the continental United States.
There's a report I want to ask you about, Doctor. The Wall Street Journal claims that Taylor Farms got on a phone call with the White House in an attempt to, quote, try to delay the FDA's recall of the iceberg lettuce. After the call, the White House greenlit the FDA to make the announcement. But how unusual is it for a company to ask the White House to possibly intervene?
You know, again, I don't know, other than I will say my experience, and I was a CDC director for a little over 3 years, it's not unusual that companies don't try to use their influence to get decisions, you know, made in their favor. You know, whether those were companies that are involved, for example, with the COVID vaccine, or whether they're looking at drug approval. So, I mean, I think the fact that they voluntarily have pulled it off the market, the bag lettuce, the iceberg lettuce that came from the central Mexico, that's good. But there probably are other sources. And I think there has been some serious, attempts to stop sourcing from central Mexico right now. We've talked about this before. The only real source of this parasite is human feces. And if the human feces gets into the irrigation supply, because there's some type of sanitation link, or or whether they're on fields where they have a lot of porta potties and they're getting leaked into the field,
Sure.
this can now not only get the vegetables contaminated, but it could actually start to get the soil contaminated. So then you have future vegetable crops that are contaminated. Very difficult pathogen, as you and I've talked about before, to get rid of. It's very sticky. You can't just wash it off. The only good news, it is treatable. So I always encourage people, if they feel they have a gastrointestinal diarrheal illness that's lasting for more than 48 hours, they ought to go seek medical advice and get tested for Cyclospora. They're very good tests that can show if you have it or not. You may have to ask for them because they're probably not routinely done.
Yeah.
And then if you have Cyclospora, or if you think you have Cyclospora, you can be treated with a drug called Septra or Bactrim, and
Okay.
it will shorten the illness. It won't eliminate it, but this illness can actually last a month. And if you have immune deficiency, it can last much longer. So the idea, if you can shorten it to 5 to 7 days, that's a lot better than a month.
There's so much confusion about this, and we love having you on to separate fact from fiction. Dr. Robert Redfield, thank you for the advice. We always appreciate you. Thank you again.
Yeah, thank you. God bless you. Bye-bye.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.